Well, a warm welcome to today's talk. It's Sunday the 20th of February. Now, I'm going to play a clip from Mr. Bill Gates in a second, and I'm a bit confused by what he's saying, so watch it and see if you can help me understand it. I think it's good news, but I'm not quite sure. So over to Mr. Gates now at at Munich.
Mr. Gates, because this is, I know, a topic that you've spoken on again and again. You were ahead of the curve prior to the beginning of this pandemic. Where would you assess where we are today in beating COVID-19?
Well, sadly, the virus itself, particularly the variant called Omicron, is a type of vaccine. That is, it creates both B-cell and T-cell immunity. And it's done a better job of getting out to the world population than we have with vaccines. If you do surveys in African countries, you get well over 80% of people have been exposed either to the vaccine or to various variants. And so, what that does is it means the chance of severe disease, which is mainly associated with being elderly and having obesity or diabetes, those risks are now dramatically reduced because of that infection exposure. And, it's sad we didn't do a great job on therapeutics. Only here, 2 years in, do we have a good therapeutic. Vaccines, it took us 2 years to be in oversupply. Today, there are more vaccines than there is demand for vaccines. That wasn't true. And next time we should try and make it, instead of 2 years, we should make it more like 6 months, which certainly, some of the standardized platform approaches, including mRNA, would allow us to do that. So, it took us a lot longer this time than it should have.
So there you go. Needless to say, if Mr. Gates wants to come on the channel, we'd be more than delighted to have him. So that sounded like pretty good news to me on natural immunity, as far as I can tell. But what's confused me is let's look at what Mr. Gates actually said here. Sadly, the virus itself, particularly the variant called Omicron, is a type of vaccine creates both B and T memory cell immunity. And it's done a better job of getting out into the world population than we have with vaccines. Sero survey in Africa countries 80% positive. Chances of severe disease dramatically reduced because of that infection exposure. And it's true we didn't do a great job on therapeutics. So what I need you to help me with is why is he saying sadly to this? Why does he prefix that with sadly? If I'd been saying something similar, I would have said I'm happy that, or pleased that, or, well, in actual fact, I'm delirious, delighted, ecstatic about this, because it means that billions of people around the world are being protected from severe disease by natural immunity to the virus, particularly Omicron, and now, as we might see, we'll see how we go for time today, but particularly Omicron BA2. So a bit confused by that. So just to mark this briefly, sadly, we'll give that a question mark. I'm not sure why he said sadly. But the variant called Omicron is a type of vaccine creates both B and T cell immunity. Hallelujah. It's done a better job of getting out into the world and the population than we have. Very much true. The doctors we talked to in Uganda, of course, say that basically now no one's getting sick. Omicron has spread throughout the whole country and it's protected the entire population with minimal amount of people getting ill. It just couldn't be better. So I'm not sure why he says sadly here. Sero survey in African countries about 80% positive and presumably rising all the time because it must be an endemic situation. And this, of course, is giving rise to huge natural herd immunity. And as Mr. Gates correctly said, chances of severe disease dramatically reduced because of the infection exposure. Correct. And he's right in saying we didn't do a great job on therapeutics, and we could argue about that for a long time. So just slightly confused why he was sad. I'm not quite sure what he's referring to. If Mr. Gates wants to come on, of course, you're more than welcome. Clarify it, talk about it. I'd love to talk to you. So there you go. I'll leave that one with you. Now, the United Kingdom, I want to point out a couple of things from the UK here, because this applies everywhere. So It applies to the States. It applies absolutely everywhere. So let's just look first of all. Let's look at the COVID symptom tracker data first of all. Here we have it. So we saw Tim Spector the other day saying he had this déjà vu feeling, and of course it is. It does look remarkably similar, the first to the second hump of the camel there, but it is starting to trend down now, but only trending down slowly. And of course this is pretty reliable data because this comes from the COVID symptom tracker study, and it's always bang up to date. Now if we can compare that with this, and this is the point I'm making, this is going to be true everywhere, cases here have fallen off really quite dramatically in the last, let's look at that one there. So cases by date reported, last 3 months, very sharp decline. Last month, continued decline. 6 months there we see the Omicron peak. So this patently tells us that the official reporting number of cases is way less than the number of infections. Way less than the number of infections. So really, these screens here aren't that much use anymore. What we should be doing and focusing on is this one here. Patients actually in hospital, which has been going down. Admissions have been going down now. That's the Omicron surge there with 3-month data. In the last month, we're continuing to go down, which is really good news. And if we look at the situation in intensive care, again, if we see well, there never really was an Omicron spike there, really, maybe a little bit, but no, that was too early. It didn't really come in till then. So no, since Omicron came in, that was still Delta in November, wasn't it? So since Omicron came in, the cases in intensive care have done relentlessly and gone down completely without interruption. And there we see it on 3 months, and there we see it on 1 month. Let's have a quick look at deaths while we're here, actually. Yeah, deaths are definitely starting to go down now. I think we can be. I think we are starting to get a trend there now. Of course, not as quickly as we would like. Now, the implication of this is that tomorrow Boris Johnson, our Prime Minister, will announce the end of all restrictions by the end of the week. And this means that people that are still protected by vaccination can be exposed to Omicron while they are still enjoying high levels of protection against severe illness and death, and they'll become re-immunised. They'll develop much better immunity as a result of the natural Omicron infection while still enjoying natural immunity, not natural immunity, vaccine immunity. They'll develop natural immunity while still enjoying vaccine immunity. If we waited, if Mr. Johnson put it off, say, for 3 months, then by that time, me, for example, the efficacy of my vaccine 3 doses that I've already had will be declining. So it makes more sense to me that I get Omicron soon rather than later while I still have good levels of protection. I can't advise you what to do. I'm just talking about me. But that was what makes more sense to me. The people that are still at risk, of course, are those that are unvaccinated at all, which is probably about 9% of the UK population. So wherever you are, I think that actually that same thinking does apply. And the deaths will start going down. They're going down in the States, but gradually. So cases now, basically, that's a work of fiction, the official cases. The cases are still higher than that, generating good levels of community immunity in people that are still enjoying protection from the vaccine. But you could argue that we've got a window of opportunity now to get the natural infection, because the vaccine-induced immunity is gradually wearing down. So that's my thinking. What you do, of course, you'll have to do what your own doctor tells you, of course. But that's my thinking about me. Now I'm going to go to Australia now. I've got a lot on. There's quite a lot on BA2 there. I think we'll leave that for now. I think we'll go to Dr. Nigel Farrier for an update on Australia. Fascinating, actually. What's happened in Australia is that Eastern Australia, sort of New South Wales, Victoria, I think. What's the other one over there called? I can't remember. But anyway, Eastern Australia, Victoria. Apologies, Victorians. And I've probably called you, probably not Victorians, it's probably something else. People that live in Victoria. So basically, they've almost got to the herd immunity stage now, because there are high doses of vaccine, and then Omicron came and sort of topped up the job, as it were, and I believe gave much longer lasting immunity. So Eastern Australia's entered into endemicity. Whereas Western Australia, they haven't quite opened up yet. Now they're planning to pretty soon, and Mark McGowan, the boss of Western Australia, the Premier, whatever he's called, has said, actually I'm going to shut up because Nigel knows much more about it than I do. So let's go over to Nigel for our update. Nigel Farrier, of course, brings 40 years of medical experience to his opinion. So, Nigel, thank you as always.
Hello, John. I thought I'd give you a quick update on Australia, as things are changing quite dramatically here. Some weeks ago, Western Australia was still closed off to the rest of Australia and the world. We were getting, in Australia, which is basically the eastern states, in excess of 125,000 cases per day. We are now down to between 20 and 25,000 cases a day. So what is happening over east is certainly New South Wales and Victoria are now removing a lot of the restrictions. So they're getting back to a more normal life and are basically living with COVID. Here in the West, we were due to open up on February the 5th. Our Premier decided that was not a good idea, as all the plans that they'd put in place was because of Delta, because these plans were made last year. And since January the 2nd, we've had Omicron spreading in Western Australia. A few weeks ago, we were getting 10s and 20s of cases. In the last few days, we've now had 250 plus cases per day. Now, these are cases that are out in the community spreading it rather than in travellers. So a couple of weeks ago, we did open up to people who've got families here and compassionate grounds and so on for people to come back in. Back then they still had to quarantine for 14 days, which with Omicron is totally unnecessary. It was shortly thereafter reduced to 7 days. I'm recording this on Sunday the 20th of February. From tomorrow at 6 o'clock in the morning, Monday the 21st of February, we're having what are called level 1 restrictions, which according to this are basically mask wearing will be in place across all of Western Australia for certain venues, public transport and indoor public settings and so on for those aged 12 and over. Gathering numbers are limited, venues are restricted to either 75% of capacity for outdoor ones or 2 square meters per person, and a few other things such as number of visitors allowed to hospitals and aged care facilities. What has happened here is now, as of March the 3rd, we are opening up to the rest of the world. So we will have interstate travellers. All they need to do is complete what's called the G2G pass, or good to go. They've got to be triple dosed if eligible, double dosed otherwise. You've got to take a RAT within 12 hours of arrival. It's mandated to report it if it's positive, and follow the usual public health and safety measures, masks and so on. International arrivals can now come into Western Australia from March the 3rd. You've got the usual complete the G2G, do a RAT test within 12 hours. No need for anybody to quarantine except international arrivals who are unvaccinated have to do a mandated 7 days in hotel quarantine with testing during that time. So hopefully he will keep to his word this time and open up on March the 3rd. He delayed it because he was hoping to get the number of booster shots up. We're currently sitting at in excess of 50% of the eligible population, which I think is over 16, having had a booster shot. And he estimates we'll get 70% in 2 weeks when we open up. WA now actually has one of the higher rates of vaccination across the country. We're 95% plus first dose, 92% plus second dose. So hopefully it's all going to be opening up on the 3rd of March. Obviously then the number of cases will skyrocket. We're already seeing a doubling of the number of cases here every 3 days, give or take a bit, maybe 4. As I said last week, we were getting 20 cases. It then went to 50, to 120, 180, 250. So yeah, doubling 3 to 4 days. March the 3rd, it'll go up a lot more than that. But at long last, we're opening up and our freedoms are returning, thank goodness. I'm sure there's a lot of people are going to be really happy with that. So anyway, John, keep up the good work. I know a lot of people are following you. You're doing a superb job. Thank you very much.
Excellent. Thank you, Nigel. As always, much better hearing it directly from someone who's actually on the ground than me. So 250 cases, as Nigel said, doubling every few days. It can't be stopped. I agree that they are carrying on with these restrictions such as they are, the somewhat limited social distancing and the mask wearing in Western Australia, because that will allow them to keep the hospital curve fairly flat, so the hospital numbers won't go up dramatically. But given the very high vaccination rate in Western Australia, I am highly confident that the number of hospitalisations will not rise dramatically. They'll probably get some increase, as we've seen in the UK. And then the community natural immunity will kick in as Western Australia moves into endemicity, as indeed I think it's a fairly analogous situation to New Zealand. Actually, I think there's community spread there now as well. So there we go, sort of the last bastions that were still hiding out from Omicron are now realising the reality that basically, and as we said months ago, it's overwhelmingly likely if you're a human being and watching this video, you're going to be getting Omicron exposure fairly soon if you haven't already, generating massive immunity. So do let me know why you think Mr. Gates is sad about that, because I don't quite get that. He may just have misspoken, of course. And of course, if he wants to come on, we'll discuss community immunity, because I think it's the best thing that's ever happened. I think it's absolutely brilliant. Now, I was going to talk about BA2. I think we'll leave that for now. It's a Sunday, isn't it? I've got we'll do something on Omicron, maybe tomorrow. Omicron BA2 sometime tomorrow. Basically, the news is looking fairly good from Denmark, where it's coming from. So nothing to worry about. It's looking fairly promising, the BA2 as opposed to the BA1 Omicron. Leave it for there. I go on too long. Thank you for watching.